Patient number 15. Patient number
Yes,
15.
ma'am.
Ay. Patient number 15, sir, no? Sige,
Opo,
sir.
ma'am.
Proceed lang ta sa room 8, sir, ha?
Sige po.
Hi, sir. Good morning. Ako ay si Zyril Marie R. Sembrano. I am your rad tech for this morning. Hi, sir. Mga paano lang ko, sir, if makasabot ba kag Bisaya, English, or unsa man imong language preference, sir?
Mas maigi po Tagalog na lang po para mag-intindihan tayo.
Sige, sir. Tagalog, sir. Okay, sir. Magtanong ako, sir, ha? Anong pangalan natin, sir?
Vince Ayan, B2B.
At, birthday po.
October 18, 1997.
1997. Okay. Edad po natin, sir?
23.
23. Okay, sir. Ay, sir, pwede po ako makatingin ng request po ni Doc, sir? Ito. Sige, sir. Saan po pala yung sir? Yung masakit, sir?
Sa Cebu.
Ay, dyan sa siko. Sige, mag-x-ray tayo ng siko niyo mamaya, sir. So, bilisan lang natin siya, sir. Kaya para makauwi ka na, kaya masakit ba yan. Tapos, magbihis ka lang doon, sir, ha. May fitting room tayo doon. Tapos, balik ka lang dito. May bigyan kita ng patient gown, sir. Tapos, mag-start na tayo, sir, ha. Thank you.
Tapos na pa ako nagbihis.
Sir, natanggal mo naman ang lahat ng metallic objects, sir. Mga ahitos, quintas.
Po, ma'am.
Arilo, sir.
Wala na
Sising.
po.
Sige, sir. Mag-start na tayo ng procedure natin, sir, ha. Upo ka lang dito, sir. Saan gani yung mo, sir?
Dito.
Ito, yan. Sige.
The IR will be 14 by 17 with SID of 40 inches. Do not forget the shielding for the patient. Sit patient at the end of the table with hand and arm fully extended, palm up.
Sir, tapos, ano kayo, sir, ha? Ito nga na po, sir? Shielding, sir, ha? Okay lang, sir.
Sit the patient at the end of the table with elbow fully extended. Extend the elbow and supinate the hand with the alignment of the arm and the forearm with the long axis of the portion of the IR. The elbow should be centered at the center of the portion of the IR being exposed. And ask the patient to lean laterally as necessary for true AP projection.
This is a collimator. So, the central ray should be here. You have to palpate the epicondyles. Then, you put the central ray at the center. Make sure to include the proximal radius and ulna and the distal humerus. So, assuming that this is a collimator, then collimate on the 4 sides and ask the patient to suspend respiration. Make sure that the central ray should be perpendicular to the IR. Then, do not forget to put the marker on the lateral side of the anatomy. Sige, sir. Ayaw talihok, sir. In 3, 2, 1, shoot!
The anatomy demonstrated, the distal humerus, elbow joint space, and the proximal radius and ulna are visible. And for the evaluation criteria, you will know that there is an optimal density and contrast because there is no motion, because the soft tissue detail in sharp is visible with the bony cortical margins and clear bony trabecular markings. No rotation was done because of the appearance of bilateral epicondyles seen in profile with the radial head, neck, and tubercles. For the lateral elbow, you have to change the orientation of your eye by 10 IR. Align the long axis of the forearm with the long axis of the cassette. Center the elbow joint to the CR and to center of the IR. Drop the shoulder as close to the IR as possible so that the humerus in the forearm are on same horizontal plane. Thumb side up so that it will be a true lateral position.
Assuming that this is the collimator and the central ray should be here, you have to palpate the olecranon process and at the medial side of your elbow. So, dapat dito siya sa center. This will be the central ray. And do not forget to include the distal humerus and the proximal radius and the ulna. So, collimate on the four sides of the anatomy and ask the patient to not make unnecessary movement. Do not forget to put the marker on the anterior side of the anatomy. So, sir, I am Taliok, sir, in 3, 2, 1, shoot. Yay!
The anatomy demonstrated is the distal humerus and proximal forearm, with the olecranon process in the soft tissues. Fat pads of the elbow joints are also visible. The evaluation criteria: with no motion and optimal density and contrast, it should visualize the sharp cortical margins and clear trabecular markings, as well as the soft tissue margins of the anterior and posterior fat pads.
Tapos na po tayo sa procedure natin ngayon. So, pwede ka na po magbihis doon, sir, sa bisanan natin, sir, para balik ka dito sa akin, tapos instructionan kita regarding sa result mo, sir, ha? So, sir, tapos na tayo na, sir. Salamat po. Tapos, sir, balik ka dito after 2 to 3 hours po para kunin yung result mo, sir. Tapos, pakita mo lang yung resibo mo, sir. Salamat, sir. Sige po, ingat po.